In this chapter, we will discuss the management of the midline diastema. It is an aesthetic problem that has many causes. It can be a transient malocclusion during the developmental years in the ugly duckling stage. It is a self-correcting case. It is seen at the age between 8 to 9 years when the centrals and the laterals are erupted, the permanent ones, but the canine is inside the bone and is in its way to the eruption, so it tilts the roots of the laterals, causing them to diverge a bit and causes this space between the incisors, and until it reaches the occlusion and it fully erupts. We're talking about the canine. This diastema closes and we get normal alignment of the anteriors. Another cause for the diastema is the heredity, where we see that it can be heredited from the father to the son. Also, it can be seen in specific races. It also can be due to the labial frenum attachment or due to the rapid maxillary expansion. Also, some oral habits like the finger suckling or the breathing can cause this type of of the diastema. Some mesiodense that is erupted between two incisors can cause this space. For the labial frenum, let's see how we can diagnose it. First, we take a radiographic evaluation of the midline, and we see a notch-like radiolucence area in the interdental region between the two permanent maxillary central incisors in the midline. Then, clinically, we lift the lip upward and see the blanching of the tissue in the incisive papilla region. If it became positive, which means it blanched, which means that we have a thick and fleshy frenum. If it was negative, we have an abscess of the thickness frenum. It is used by frenectomy, and after that some appliance can be used, whether it is fixed or removable. This is a removable orthodontic appliance with finger springs that can be used to close the diastema, but it can cause a space between the laterals and the centrals. Also, this modified labial bow can close the diastema also after being activated, but cause the same problem of space between the laterals and the incisors. Some fixed appliances can be used where we add closed coil spring between the brackets of left and right permanent centrals to bring about the closure of the midline diastema, and each chain fixed appliance can be used where the brackets are placed from the first permanent molar to in the right to the left permanent molar in the left. Here, an M spring that is a modification can be used in the middle line diastema correction. We have an elastic thread wrapped around the brackets also. Some conservative approaches of adding restorations, resin or ceramics. Now for the retention. It is so important to retain the diastema because it has a potential to relapse. So we can use a passive retainer, which is the Howley's retainer, which is a removable appliance, or we can use a fixed bonded retainer from the canine to the canine.